Hey, Justin White here, Senior Health Services CEO and founder. Welcome to Medicare Monday. I appreciate very much you attending and watching. First off, right out the gate, I want to wish a very happy Veterans Day to all of our veterans out there. My gosh, I wish we could always say that we don't take you folks for granted and the sacrifices that you've made, because I know that we do compared to what you went through, and thank you so very much for your sacrifice and your service. So hope you guys have a great day and feel appreciated today. So I wanted to come on here and talk about on this Medicare Monday and the almost 1 week after the election. And by the way, is anybody glad besides me that all that mess is over? Good heavens gracious, I'm so glad that's done. I know some are happy, some are not, but it's over and we can move on down the road and do what we need to do. And that's the topic of today. And I've covered this a little bit in the past, but I want to reiterate for those that are out there and have been sort of waiting around. I just want to make sure and let everybody remember and know no changes are coming to Medicare. Unless this current administration does something, there will be no changes to the Medicare program before the 1st of January when all these plans that are being advertised now go into effect. So waiting until the very, very last minute is going to do nothing but make it harder for you to get an appointment to get your plan reviewed. So I want to make sure that you understand that. Now, after that, and actually after the inauguration, sometime in the latter part of January, at that point when the new administration comes in and they finally are able to, I don't know where it falls on the agenda, but start looking at things, then we might start seeing some adjustments being made. And one thing that I am personally hoping that they do is basically reinstating the funding to the Part D program that the Inflation Reduction Act stripped out starting in January. Okay, I don't know if a lot of people remember because it's not being reported. I've talked about it and many others have talked about it, but basically the Inflation Reduction Act as of January of 2025 radically cut the amount of money going into the prescription drug part by Medicare. It's just, and so they cut that a lot, and then they went into and they shifted that over to the insurance carriers and then didn't give them any more money to deal with it. And that's the reason people's plans are changing so radically. That's the reason people's plans are being canceled and you're watching your benefits get degraded and all that stuff in the MAPDs. That's the reason it's changing, is because the carriers are trying to figure out how to pay for the benefits that were used to be being paid by Medicare itself when they cut it. And you can read it in the press releases and things. They say, hey, starting in 25, the insurance carriers and Big Pharma are going to be paying more. Well, Big Pharma brought a 20% coupon to the table in the catastrophic phase, right when it got expensive, and Medicare's cut from 80% to 20%, and the carriers are going from 20% to 60%. That's a huge increase for them. And with no money, they had to go in there and really figure out how to do it. So add to that the fact that they've already bailed out this part of the law. It's called a demonstration program. I became aware of it at the very end of July, and they probably looked at the bids that were coming in and said, this is not good, because they were seeing how much the premiums were going up and how much more cost was going to be going on to the beneficiaries, meaning the Medicare recipients. And they said, we can't do that. So they came up with this demonstration program, which essentially funnels money into it and bailed out the standalone Part D prescription drug plans. They did not bail out the MAPDs, which is why so many people are seeing changes or seeing their plans canceled. Not all the plans are being canceled, obviously, but there's a lot of them. There's a bunch of them out there. So we're hoping that maybe the new administration will go and put that funding back into it and then figure out a different way, to cut costs, which all of us agree and know that needs to be done. Hint, hint, maybe they should talk to Big Pharma. That would be nice, right? To go in and chat with them and say, yeah, let's accelerate this negotiation process, at least for our Medicare beneficiaries, and let's bring the cost down that way. That would be nice. But the premium increases were just not sustainable for most of our seniors. Okay, so that's my 2 cents. So bottom line, what am I saying? If you have not gotten your plan reviewed, call your favorite agent and get in front of them as soon as possible to find out what's going on with your plan. If you don't have a favorite agent, call Senior Health Services. We're free. We will sit right here and help you out, help you understand where your plan is today, how it's changing next year, and what, if any, changes make any sense for you to make. Okay? So I hope this finds you well. Again, happy Veterans Day. Thanks for watching, and we'll see you next week on Medicare Monday.